So I would love for it to be okay, but we need to be sure.
Oh, there you go. And sometimes we come out with some inventions, and in one aspect they're fantastic,
Right.
but it can be having negative effects in other ways.
Yeah.
The jury's still out, I suppose.
Yeah.
Yeah. All right. So specifically to people, if somebody has just been diagnosed with breast cancer, what would you say to that person about their diet? If you had to go into them, and I'll start with you, Azelia, what would you be looking for if somebody presented themselves in front of you with breast cancer?
Okay, so once an individual has been diagnosed with cancer, there is a difference between preventative. Some of the things that you would not necessarily do in terms of watching your fat intake and your calorie intake, and so preventatively can change depending on what point you're at in the cancer. So if you're just diagnosed and you're not experiencing weight loss, you're not experiencing some of the other symptoms that come along with cancer, certain cancers, then I would tell the individual to ensure that they have a diet which is rich in the fruits and vegetables. But I would be more specific in terms of I do a whole rundown on weight, height, see what their calorie needs are to make sure that they maintain the weight that they need to be at, because weight loss is something that is real with cancer.
So you get that specific with regards to their
Yes.
individual height and individual weight.
Yes, for all the patients I see, I'm very specific. Because I think it's one thing to tell somebody, reduce this, cut down that, add more of, but I like to be specific in terms of reduce to how much. I like to do measurements and weights and so forth, because food is a chemical as well. And if you want to achieve a specific purpose, then you need to be specific.
Yeah.
And that's what I pride myself as being a dietitian, to be able to go very specifically. So there's research, there are formulas, there are different things that you calculate to be able to give an individual exactly what they need. Because it's not the same for each and every individual. Because if you presented breast cancer and let's say your BMI is 40, which means you're obese, it's not going to be the same.
Let's clarify for the listeners, BMI.
Oh, sorry, body mass index. It gives an indication of what your weight for your height should be. So if you present and you're obese, so you have too much weight for your height and too much fat as well, my nutritional assessment for you will be different from somebody who presents as a very active individual who has a normal weight and they had just been diagnosed with breast cancer. So there is a difference.
All right, I want to ask you this question, Lisa. What would you prescribe for somebody who hasn't been diagnosed with breast cancer, but they have some ailments, there are things troubling them and they're not in a good place, and you want to make sure that you're having them to prevent cancer?
Okay, firstly, I will take a diet history. For example, find out what are you eating, what are you drinking, because sometimes people are drinking alcohol, maybe smoking, so you're looking at sort of the risk factors. What are they exercising? And if they're not, then you do an intervention. Find out, okay, this is where you're at, and let's get you to a stage where you can prevent yourself from getting cancer.
Let me jump in. You said a diet history, right? What does a diet history tell you about something?
It tells you what the person is eating, how much, how often, and in terms of their quantities, etc. You can take it for 3 days, you can ask the person generally how do they eat for breakfast, lunch, and dinner. And then some people don't remember, but you should know how you normally eat. Sometimes you take a typical day, which might not be, but because taking a diet history is not absolute, but you can get a feel of how the person is eating. For example, you can see that the diet might lack vegetables, it might lack the healthy foods that they need, peas and beans.
And what about this? Something that I hear quite a bit when you talk about do you have a healthy, rounded diet? And somebody will say, yes, I always have
no, we don't
salad.
ask it like that.
I always have salad, and so you ask, well, what do you put in your salad? I always have my cucumber, everything. I always have my cucumber and some lettuce. And that's it. Nothing else. Never any greens, never any beans. That's it. Round provision, meat, and maybe some cucumber.
So you have to ask many questions. As a dietitian, you have to ask many questions. You have to be specific. Sometimes people are dishonest, but if you know how to catch them, you can ask another question that sort of
In
puts
what
them-
way? They say they only have a certain amount and needs a lot more? Or something?
Yes, you have to be you have to be very technical in how you ask certain questions.
You've had that as well?
Yeah, some people they come and they portray what they want to be. So they will tell you, yes, I exercise, and well, I have vegetables most of the time and so forth.
Yes.
But then when you look at certain things, like if they come with lab work or if they are overweight or so, and they're always exercising, so you can say, well, you're always exercising, but why, your weight, it hasn't gone down, it's about the same, you're actually overweight or obese, so what else is happening? And then you can ask other pointed questions that you can eventually pull out and see when things don't add up.
Yes,
You
when
can
things add
get,
up.
you can get individuals to
Yeah.
come around to being a little bit more honest with you.
But is it possible, though, that people themselves, rather than it being outright lying, that they're disillusioned with regard to their own eating habits?
Yes, you have that as well.
They're just completely
Yes.
unaware. I can remember trying to help somebody with their weight, and very progressive, very active, someone who takes the task on board. But we were not getting anywhere with this weight. So I decided, well, let me come to your house and actually see what your breakfast is. Well, my goodness, when I saw the breakfast plate, I've never this is huge. Almost basin-like in size.
Yes. And in their mind, they
it's
think
not-
it's normal.
Right.
We have these cases as well,
You
where they
have?
think I don't eat much, but I remember somebody who was quite big, probably 300 to 400 pounds, and she would tell me, I don't eat much. I'm like, really? You don't eat much? I'm like, so how are you always putting on the weight? And this person, I had the opportunity to see this person eat. Oh my God, the plate was hit. Like I tell you, hit. And this person is telling me she's not eating much, and I'm like, are you lying to yourself, or is it that you do not feel full after you eat all so
I
much?
think it's a concept of what a lot is.
It is the concept, but then I would say
concept.
there's some emotional eating going on
Yeah.
as well,
Yes.
some other issues.
Mhm.
But then people are not recognizing that the amount that they have is a lot. So again, coming down to nutrition, I think that people are not recognizing that what they're eating is actually not good for them, or the way they're eating is not good for them. And
Or
I
how
re-
much they're
Right.
eating.
Yes.
And
Portion
I-
size is the problem here. I
Yes.
think the portion sizes are way too much in St. Lucia for
Yes.
both men and women.
Yes.
They believe especially the men, when you're a man, they're working and they should have a really huge plate of food. But most times our body needs so much less because we are not very active.
Yeah.
So-
And that's why when you look at people when they get to about 35 plus, you can see the difference in the body. It's like a transformation. Double the person, triple the person.
Yes.
Yeah, because metabolic rate gets affected.
Yes.
So when you're younger and you might be, more active, or you have for women that have more of the hormones and so helping to protect against, and you find you're slim, you're eating this, you're okay. Then when you hit 30,
Yes.
not even 35, sometimes it's 30, or actually 25, your metabolic rate starts
That's
slowing
so
down
At 25.
from 25. So by the time you hit 30 or so, for some people, they realize the weight. I'm eating the same way. I might be exercising about the same, they may not have been doing much anyhow, and they realizing I'm just packing on the weight. And then they realize, wait, maybe how I was eating before wasn't necessary. Well, some recognize, not everybody. Not everybody.
All right. Well, you know what I'd like to tackle now is, and we'll go back and forth. Each one of you will throw something out. All right? Foods that are preventative with regards to cancer. All right, that we have here, that we can get a hold of fairly easily. All right. Excuse me.
High fiber foods like
No, just pick one thing. Each one of
You
you.
wanna go back?
Yeah, because it really crystallizes it in the listener's ear. What we're trying to do is make it something that they come away with and they can start doing straight away.
sweet potatoes are our provisions, high in fiber,
So you're gonna pick sweet potatoes. Why? Why
Mhm.
sweet potatoes?
because it has so many healthy nutrients in there, and it's also high in fiber. And fiber is protective against cancer.
Right, that's what I
Fiber
want.
helps
Why?
to
Yeah.
helps to sweep away free radicals. Helps to sweep away toxins in the body that could actually stay in there and cause cancer.
Lovely. That's what I want to hear. So when we're eating our sweet potato, we can actually look at it like a broomstick going in
Yes,
and actually
sweeping
doing
away
some good
toxins,
work.
yes.
And this magic word you keep hearing about, fiber.
Excellent. Yes.
And what sort of cooking preparation would you suggest?
Just like we boil our sweet potatoes is fine.
Boil is alright.
Yes.
What about the bacon, sweet potato?
Yeah, you can bake your sweet potato, but I don't like so much. Some people bake it in maybe sugar and stuff. I prefer to just bake it as it is.
And what
You
about
can make
fries?
sweet potato fries, but
Yeah.
in the oven.
Okay.
You can strip it and season it with some paprika, a little bit of Italian seasoning, and a little bit of coconut oil. Sprinkle on it, and you can bake it in the oven.
Yeah, that's what
So
we
that
want to
could
hear.
be-
Some
yes.
healthy ideas around, our food. Okay, Azelia, pick one.
Lentils.
Mm.
Yeah, lentils are protected because they have high in fiber and they also have phytochemicals as well.
Explain
and these
that.
phytochemicals, they help to reduce free radical damage. Free radicals are some of the bad components that tend to damage cells. And with cancer, from a cellular level, cancer is cells that kind of go out of control. So you want to, if you take lentils, and it's not only lentils, the whole legume family, lentils, red beans,
Black-eyed peas?
black-eyed peas, any type of peas and beans that you can get your hands on, and include it daily. Daily, taking in lentils, legumes, some sort of peas and beans, good source of fiber, and you have these phytochemicals in there as well.
And what about when we're making our soups? It's good that way as well in a soup?
You can put it in a soup.
Yeah.
I mean, some of these things I know, I'm just trying to get the most that we can get out of this for our listeners, because very often, sometimes, remember, we're now in a much more modern age. A lot of people like to just drop down to the Kentucky or any other food outlet, and sometimes we're missing out on some of the nutrition that we need to have daily.
Yeah, because these foods are not nutritious at all. I mean, they're practically dead food. And the oils that they use to fry these meats, sometimes the oil is used over and over, and it actually causes, yes, but only once it breaks, the oil disintegrates and actually can cause free radicals. And when you consume it, then it's the same compounds she's talking about that are carcinogenic.
Right, which is actually increasing our risk of cancer.
Yes.
Yes.
So let's talk about our oil choices as well, because we have a variety of different oils on the shelf. Without really naming any that we might think is bad, but let's name some of the ones that are good for us to use, in your opinion as a nutritionist.
I'm a coconut oil person. I am all for my coconut oil.
So you're
and
talking about virgin coconut oil.
well, this is another show for this virgin, and this virgin coconut oil, I mean, I'm talking about coconut oil, the one that we actually make it at home. I know some people don't consider it to be virgin, but I actually did a little research looking at the coconut oils, and the ones that we are making at home is actually quite good.
Okay.
Yes.
Azelia, what do you think?
Yeah, I agree. Coconut oil is good. I think back in the past there were the misconceptions with coconut oil being damaging. That's because it is high in saturated fat, but the type of saturated fat, you were likening it to the fat found in like butter and cheese, but our body doesn't metabolize the saturated fats of coconut oil the same way. So it's actually a beneficial oil. So that's why there was this whole discrepancy back in the past. So I think now people can use their coconut oil with, be a little bit.
Feeling good about
Yes.
themselves, they're doing something good, right?
But also
and you can
remember-
heat it, can't you?
Yes, that's the
it's
thing.
very stable.
It's
That's why it's
stable.
so good. It's very stable because of the saturated fat in there. It's actually very stable, so it's the best oil to fry with.
But you have to be careful. It's an oil nonetheless. So while it's a good oil to use, you still want to keep within the amount of fats that you take in there. It doesn't mean that coconut oil is good, so I'm going to use a whole bottle.
And that goes with every food.
Yes.
Because that's a food is good doesn't mean you can have any amount. And that's
Right.
one of the things I think people don't understand. That when something is good, they feel that they can have any amount of it. No, you still have to stay within the guidelines and
Yes.
moderation and etc.
Yes.
Because anything that is good, you have too much of it, it becomes bad. No matter how healthy
Nothing
it
in
is.
excess, right?
Yes.
I think I'd also say including olive oil if you can afford it and get it, because it has monounsaturated fats, which has benefits as well.
But is there
in
an
the body.
argument as opposed to not heating?
Yes, I would
olive
say
oil?
Don't heat it.
Yes, use it on salads.
Salads and stuff, yeah. Because when you heat it, it kind of deleaches the compound and it starts to affect.
Coconut oil is the best for heating.
Yeah, if you have to heat,
And okay, I want to take on a big one, cereals. Okay, and we have a number of different cereals here. And when I was young, I suppose my parents are West Indian, so they used to like to get as many West Indian things as they could in the UK. And I can remember having things like cornmeal for breakfast, semolina, I think, and things like that. So, and porridge.
Right.
So that's my traditional type of cereal, and I still like things like that. But nowadays, you can see it with the children in particular. You have all these multitude of different colours and different things and shapes and what's not. And do you think that they're good for you? Do you think that it's a staple diet for us to be having this little cereal every day?
It depends on the type that you're having. As much as cereal go through, you're talking about the box cereals.
Yeah.
As much as they've gone through a series of processing, there are some that are better than others. Once you see those with those colors, you know that they've added some coloring and some
And they say
additives to them.
fortified vitamins and things like that.
Yeah. So if you want to know how good a cereal is, look at the fiber in there, look at the ingredients. The less ingredients it has, the better, because that's less things that they add to it. So I think, should we name any? Or?
No,
Okay.
we're not trying to put
To promote, but on the cereal bit, I normally recommend high fiber cereals.
Perfect.
So you're
You
looking
should-
at
you can talk about the
Low
ones you
sugar,
recommend.
high fiber.
If there's ones that you
Yes.
recommend, please do.
Oh yeah, well that's what I was gonna.
I thought you
will
meant
call the bad ones. No, no.
Please, recommend.
oh
It's like Weetabix. I think Weetabix is high in fiber, it's low in sugar. And should I say? Weetabix is a brand, so I'm talking about there's so many different.
there's
That's okay,
variations
that's
of
okay.
Weetabix.
Yes.
Yes. So Weetabix is cool. Then again, it's also what an individual has. For some people, sometimes I recommend honey bunches of oats. Because when you really look at the sugar content as compared to some of the other cereals, it is actually not that bad, even though it says honey bunches of oats in there. And it's decent in fiber. It's not high fiber, because high fiber is anything from 5 grams of fiber and more.
So what about something like farine?
Yes, farine, of course we promote farine. I guess we're winning the box ones.
Yeah, we're
It's
looking at the
fine,
box cereals.
It is high in fiber, it has some nutrients.
Sometimes we forget
It is
that.
high in it is high in carbohydrates, but we need carbohydrates for energy. So yes, we recommend farine. In fact, this month we are promoting a lot of cassava foods because we want people to use more cassava. It's our local food product, and of course we know there are no additives in there. And yes, farine is fine.
But I will also say it's portion control, especially if there are diabetics listening to this. As Ms. Michel said, you have, it's a carbohydrate. And it's concentrated when we eat our cassava bread and cassava, these, it's a lot in. And so for a diabetic, the portion is really important because your sugar can go sky high if you take,
And that's another thing that I
Yeah.
think people don't realize, and please confirm this for me, is that carbohydrates does equate to sugar.
It changes
changes
into
the
sugar.
final
Yes.
product is glucose. Yes.
And so we're not realizing it. We really need to understand what's on our plate. Maybe when we come back from the break, you can help us to do that a little more, because I think sometimes that's where people